Hey, Miss Shandick.
Hi, how are you?
Good. Chandler Zalek, student nurse practitioner.
It's good to see you.
You too. How have you been?
I've been good.
Good. So what brings you in today?
I'm just here for a baseline musculoskeletal assessment.
Okay, perfect. Any issues in the past with any musculoskeletal issues? Any sprains?
Nope.
Strains?
Nope.
Broken bones? Fractures?
Nope.
No. Any muscular pain at all? Ever have any tears? Any injuries? No? Wow, okay. All right, you're a lucky duck here. Perfect. All right, so to start, I'm just going to ask you to stand up. I'm going to observe your posture. Perfect, okay. I see that everything is kind of symmetrical. And I'm going to have you take a few steps towards me. I'm just going to look at your gait. Perfect. It looks steady and then back. Perfect. All right, Miss Chandler, you can have a seat. And no pain with walking or anything like that?
Nope.
All right, perfect. So we'll get started. I'm grabbing some hand sanitizer. And what we're going to do is we're going to start with the neck. Okay? I'm just going to move the hair out of the way if you don't mind. All right. So first, I'm just going to palpate. Any pain there? No? Okay. Inspecting, no redness. Everything looks symmetrical. So we're going to start with range of motion exercises, and pretty much for every single joint and body part, we're going to be doing that, just so you kind of have a rundown of the exam. So I'm going to start with asking you to tuck your chin to your chest. We're going to check for neck flexion. Perfect. And then if you could put your head back to your shoulders, great. We'll look for some extension there. I'm going to ask you to twist your neck to both sides. Perfect. Looking for some rotation. And now we're going to laterally bend. So, yep, ear to shoulder. Perfect. And ear to shoulder. Great. Any pain with that at all?
No.
Okay. And now I'm just going to have you do a neck circle. Get all the range of motion there. No pain at all? You can. All right. Perfect. So now we're going to move to the jaw. Any dental issues at all? And currently no pain or anything like that? Okay. So with the jaw, I'm just going to take a look. Perfect. I'm just going to feel. Everything feels even and symmetrical. All right, great. So I'm going to have you just open. Perfect. Close. Great. And now I'm going to have you do some protrusion and retraction. So for protrusion, I'm going to have you stick your bottom jaw out. Perfect. Just like that. And then retraction, put it in. Great. Any pain with that? No? Okay. And then we're going to do some lateral motion. Okay. So that same, to your left, to your right, left, right. All right. Perfect. And no pain with that at all?
Nope.
Great. So with that, now we can move on to the shoulders.
Okay.
Okay. So again, I'm going to move the hair out of the way. And I'm just going to inspect your shoulders, looking for any redness. I'm looking for symmetry between the two. Everything looks good. It doesn't look like you have any deformities at all. Normally with people who have any tears or dislocations, we can kind of see that right upon assessment. Perfect. So we're going to start off. I'm just going to have you move your shoulders up and down. Okay. Great. And then what I'm going to do is I'm just going to be palpating for some certain structures, okay?
Okay.
So I'm going to start with just basic clavicle. Okay. And you let me know throughout this if we have any pain, okay?
Sure.
All right, I'm going to go to the sternoclavicular, and then up to the clavicle. There's a joint up here called the AC joint. Any pain there? That's a lot of times where athletes or anyone has pain. Okay. I'm going to move down to the bicipital groove. Any pain there?
No.
Okay. And then we're going to go to the scapula. Okay. And then we're going to go to the glenohumeral joint, just right where the humerus connects to the shoulder. Perfect. All right. No pain with any of that?
No pain.
Okay. So now we're going to do some range of motion for the shoulders. So I'm going to have you, we're going to do some flexion.
Okay.
So up. Perfect. Extension. We're going to go back. Okay, great. Yep. And then we're going to do some abduction. So abduction, we're going to take away from the body. It's kind of like a medical term, okay?
Sure.
So arms out, yep. And then adduction, we're going to add to the body so you could cross them. Perfect. Any pain, uncomfortableness with that? All right. We're also going to do something called external rotation. So I'm going to have you take one hand at a time. You can start with whichever you want. and rotate it like you are scratching your lower neck, okay? All right, perfect. And then the other shoulder, just take a look at everything. All right, perfect. So now we're also going to do some internal rotation. So same way, I'm going to have you take that hand, but put it up like you're scratching or you're feeling like that. Okay, good, very good. And then with your other arm. All right, perfect. And those feel about the same. Okay. So then after that, we are going to move on to the elbow. Okay. So with the elbow, we are going to start. I'm just going to have your hands like this. Perfect. I'm just going to inspect for any redness, any swelling, any deformities. They look good. Perfect. And now I'm just going to feel any pain or tenderness there. Okay. So you can actually bend your arms just a little bit. I'm just going to start on this arm. I'm going to feel for the Ocarian process. Okay, now the Ocarian bursa. Now I'm just going to have you flip your arm just like this. Okay. And now I'm going to be looking for feel the medial condyles, which is on your pinky side. That's the medial, and then the lateral. Perfect, and everything feels great so far. All right. So now we're going to move on to the range of motion for the elbow. So first we're going to do some extension. So, okay, extend the arms out. Perfect. And then flex them back in like you're doing a bicep curl. Perfect. And then pronation. Put the arms stay up. And then supination. We're going to bring them up. Excellent. Okay. No pain. All right. Seems like you've been through one of these before, huh?
At times.
Yeah. It's good to kind of get everything checked out. All right. So after that, we are then going to go on to the wrists and the fingers. So we'll start with the wrists. What I'm going to do is, go ahead, you can bring them out. I'm going to inspect. I'm looking for symmetry. I'm looking for redness. I'm looking for any cysts. A lot of times this is a common place where people can get like a fluid buildup. Ever have anything like that before? Nope. Okay, perfect. Everything looks normal, symmetrical, no redness or tenderness. So I'm going to start palpating, which is feeling of everything again, okay? So first, I'm just going to feel, have you go, yep, turn just like that. Perfect. I'm just going to be feeling for the carpal joints. Any pain at all? Okay, perfect. And I'm going to have you turn around, and now I'm going to be feeling for the metacarpal joints. Okay. Now we're going to go to the metacarpal phalanges, which are the most proximal joints. Perfect. And now we're going to go for the proximal interphalangeal joints. So these are those middle knuckles, the ones that people like to crack, and you know I'm going to do it on both sides. Perfect. And then I'm going to be doing the distal interphalangeal joints. Good. Any pain? All right. Perfect. So then what I'm going to have you do is we're going to do the range of motion. So with the wrist, I'm going to have, yep,
So flex.
flexion, yep, extension, perfect. We're going to abduct, so away from the body, perfect. And then adduction, we're going to add to the body. Great. Any pain? Okay. So then with the fingers, we're kind of going to do the same thing. We're going to do finger flexion, yep, in, and then finger extension. Try to get those out. Perfect. Yep. And then you can put your hands just like that for me. Okay. Now we're going to do finger abduction away, and then finger adduction in. Perfect. So then we're going to move on to the thumb. Okay. So we're going to do thumb flexion. So down. Yep. And then thumb extension up. Okay. Also abduction. Perfect. No pain in any of those joints at all. Okay. Good. 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 You're like what we like to call a good patient, Jen. So next, what we're going to do is we're going to go to the hips, the knees, the ankles, and the feet. Okay. So for the hips, I'm going to actually have you lay down. And I'm going to have you lay down on your belly, if that's okay.
Oh.
Any pain ever laying on your belly or anything like that?
No.
Okay. Good. So now I'm just going to be inspecting. Okay. So I'm going to pull your shirt a little bit. Don't mind. Okay. Any pain here at all? No. Okay. So now I'm going to palpate. We're going to start at the sacroiliac joint. So you know those little dimples on the back? Yeah, that's actually kind of where those are. Any pain with that at all? No. Okay. So now I'm going to be feeling for the iliac crest on the sides. Right there. Perfect. And now we're going to go to the trochanteric bursa, which is the lower portion of the side hips. And then the iliac crest, right on the side. And then the greater trochanter, which is kind of right underneath here. Any pain at all?
No.
Okay, perfect. So while we're in this position, we're going to go to range of motion, and I'm going to have you do some extension. So if you just want to lift each leg individually, kind of up to the sky for me with a straight leg. Perfect. Good. Yep, and then you can do the next one. Excellent. All right. And I can have you roll over. And lay back. Perfect. So now we're going to do some flexion. So we're going to have it each individual leg up. Perfect. And then next one up. Perfect. Okay. So now I'm going to have you lay on your side. Okay. Roll on over. All right. Great. So what we're going to do now is we're going to do some abduction. So we're going to bring the leg up. Yep, straight leg. Perfect. Okay. And now we're going to do some adduction, which is actually going to be bringing it across the body. Yep. Okay, great. Yep, no issues with that. Any pain? No? All right. So now we're going to flex our knee and do some internal and external rotation. So if you could flex the knee for me. Okay. We're going to go in, internal, and then out with the flex knee as well. But I know it's kind of hard to couch. Perfect. Okay. Great. So you can sit on up for me. We're done with the hips. We're going to move on to the knees and the ankles now, and the feet. So I'll take a look at the knees, kind of same way I did for the elbows and the shoulders, looking for symmetry, looking for any redness, any pockets of fluid at all, but everything looks good. So I'm going to start palpating. I like to frame the patella to palpate. So I'm going to start, I'm looking for the patellar pouch. Good. Any pain? Okay. Now we're going to be looking for the patella femoral tibial joint, and then the femoral tibial joint. Patella fibular joint. And then I'm going to be looking for the anterior tibial tuberosity. So it's actually on the other side of your knee. Could you just scoot up a little bit so I can visualize? Perfect. Sure. Okay. And palpate that. Any pain? No? Okay, good. And then I'm just going to be looking, good. That was the popliteal fossa that I just looked at. Sorry, excuse me. I mixed them up.
That's okay.
Okay. And then the anterior tibial tuberosity is actually on the front of the knee. Right about there. Okay. All right. So now we'll go to the range of motion. So we're going to do some flexion and extension. So with the knee flexion, if you could just, we're going to do flexion extension. So yeah, back and then forward. Perfect. Any pain with that?
No.
And then the adding and abbing again. So we're going to do some abduction away. Yep. And then kind of just with the knee, we're going to, yep, and adduction. Perfect. All right. So now we can move on to the ankles and the feet. Looking for symmetry, looking for redness, everything looks good. I'm going to palpate. All right, so I'm going to be feeling for the medial and the lateral malleolus, which are those little bony prominences on the side of your ankle. And then we're going to be looking for at the metatarsal joints. Any pain? paint it all. Okay. And then the phalangeal joints. And then the interphalangeal joints. Perfect. All right, everything feels great so far. No abnormalities or deformities. Okay, so then we're going to do the range of motion with that then. So we're going to start, we're going to do inversion with the ankles.
Okay.
So inversion, it's kind of like adduction. So we're going to move the ankles in. Yep, great. And then eversion, yep, move them out. Perfect. And then we're going to do plantar flexion and dorsiflexion. So go ahead, press like you're pressing on the gas pedal. Perfect. And then point those toes up. Great. All right. Any pain at all with that? No. Perfect. So now lastly, what we're going to do is the spine. Okay. So I'm going to have you stand up for this one. Okay. So first, I'm just going to inspect. Like I said, shoulders from the back look symmetrical, no deformities, everything looks straight. I'm just going to run my hand down. Okay. So now I'm just going to be feeling. I'm going to start at about C7, which is one of the cervical spines. And I'm going to be feeling for all the spinal processes. Okay. And now I'm going to be feeling for the paraspinal muscles, which are right next to the spine up here. Okay. Any pain or tenderness? No. No? Okay. So now we're going to go ahead with the range of motion. I'm going to have you flex. So I'm going to have you bend down and touch your toes. Perfect. Any pain, everything looks even and symmetrical. Okay, you can stand on up. And now we're going to do some extension. So just a, yep, slide. Perfect. Good, good. And now we're going to do some rotation. So we're going to do some twists. Yep, twist, left, right. And then kind of just like we did our ears to our shoulders, just good to one side and to the other. Perfect. And that's called lateral bending. All right. So you can have a seat again. Perfect. So everything looks really good. Do you have any questions for me, Miss Shandik?
No, I don't.
No? Okay. No pain or tenderness? No. Great. Well, it seems like you're in good shape, athletic. Just kind of keep doing what you're doing, and if you have any issues, come see us again. But as always, I would just recommend an annual baseline assessment, okay?
All right.
All right, Miss Shandik. Thank you so much. Sure.